A look at the health and medical situation in Iran. Health is a paramount concern for any society, both among the public and the official authorities of any country, as it underpins social, cultural, economic, and scientific progress. Hence, developed or developing nations prioritize providing extensive facilities to ensure the health and medical care of their citizens, making medical treatment and preventative healthcare a cornerstone of policymaking. Iran is no exception to this rule. However, the current situation in Iran differs significantly from the objectives pursued by other countries. But what is happening in Iran bears little resemblance to the principles and objectives of other countries. Descriptions of the healthcare landscape in Iran often evoke comparisons to medieval Europe and the horrors of Black Death, which seem incongruous with the advancements expected in the 21st century. The medical and treatment situation under the rule of the Ayatollahs is described as exceedingly dire, to the extent that even state media portray it as extremely bleak. With only 1.9 hospital beds per 1,000 people in Iran, falling significantly below the World Health Organization's recommended minimum of 3 beds per 1,000 people, patients frequently succumb while waiting in hospital queues. Additionally, many patients fall victim to shortages of essential medications, including drugs for cancer treatment. The authorities of the Iranian regime blame the shortages on sanctions, but the United States has repeatedly stated through various statements that all matters related to drugs, medical equipment, and agricultural products are exempt from sanctions. Even Ashraf Farahmazanpour, the director of the Haemophilia Patients Association in Khuzestan, emphasized that the reason for the shortage of specific drugs is not sanctions, but the incompetence of Iran's Ministry of Health. Indeed, the incompetence of the Ministry of Health has effectively fostered a black market for drug smuggling in Iran, because the same specific drugs that are not distributed by the Ministry of Health are bought and sold on the black market several times their original price. This situation extends beyond just a few medications. Over 200 types of drugs are experiencing shortages, directly impeding patients' treatment processes. Furthermore, there is no indication of improvement, and experts in the health and medicine sector anticipate even worse conditions ahead. This stems from the oppressive government policies enacted during Raisi's presidency, which significantly reduces subsidies for medications and medical equipment in 2023 compared to the previous year. Government experts warn that this budget allocation only covers expenses for 3 months. On the other hand, marginalized individuals are experiencing a continual increase in the prices of essential medical items without having the additional resources to afford them. Moreover, numerous insurance companies have excluded vital medications from their coverage, citing insufficient budgets to cover medication expenses. Examining the soaring prices of drugs, one can discern the influence of the pharmaceutical cartel, which is entirely monopolized by companies associated with the Barakat Foundation, owned by Khamenei. Indeed, the mullah's regime has established a pharmaceutical mafia in Iran, which not only controls imported drugs but also monopolizes the distribution of domestically produced medications. Pharmaceutical holdings are predominantly owned by leaders and officials of the regime, as well as the members of the Revolutionary Guard Corps. One of the most notable examples is Barakat Pharmaceutical Holding, directly owned by Khamenei himself and overseen by Mukbar, who serves as the deputy chief of staff under Raisi, the current president of the Iranian regime. During the COVID-19 pandemic, when nations were striving to secure and import reliable vaccines, Khamenei issued a direct order to halt the entry of vaccines, advising people to await domestically produced vaccines from the Barakat holding. However, experts revealed that the vaccine manufactured by this holding exhibited minimal effectiveness against COVID-19, and consequently, according to non-governmental organizations, over 500,000 individuals in Iran succumbed to the virus. Based on reports from government publications, in 2021, the Khamenei banned vaccine imports. The Barakat Pharmaceutical Group experienced its highest profitability growth ever. In reality, medicine and healthcare have evolved into one of the most lucrative sectors within the Iranian regime, with profits being diverted towards quelling protests by the Iranian people and financing weaponry for the foreign proxy groups of the Mullah regime in Syria, Iraq, Lebanon, and Palestine. The regime's military security budget is predominantly directed towards reinforcing suppressive apparatuses and propaganda institutions, with little priority given to healthcare, particularly medicine. In the past year alone, the budget of the Revolutionary Guards surged by 28%, and the Ministry of Intelligence witnessed a staggering growth of 52%. Conversely, the budget allocated for pharmaceuticals, medical consumables, raw materials, and medical equipment production plummeted from 4 to 1. From the approved budget of 73 trillion tomans in 2022, only 13.4 trillion tomans was disbursed. Similarly, out of the approved budget of 69 trillion tomans in 2023, only around 5 trillion tomans were paid, whereas 17 trillion tomans were earmarked for disbursement. According to statistics and regime-affiliated media, the government allocated a budget of 69 trillion tomans for the previous year for pharmaceutical subsidies and medical equipment, exacerbating problems in the pharmaceutical sector as this budget was only efficient for 3 months of 2023.
On the other side, the actions of this government-backed mafia have resulted in distressing scenes of patients in state hospitals and clinics. Hospitals are unable to acquire new and advanced equipment due to lack of funding. Additionally, people's visits to hospitals have dwindled because they cannot afford the escalating treatment costs. According to media and government-affiliated sources, the substantial annual increase in healthcare costs places a significant burden on a large part of the population, driving many below the poverty line. Given the current economic situation, an overwhelming 90% of the population cannot afford medical care in private hospitals, and most rely on government-run facilities. This situation presents challenges for both the public and private sectors. The public sector grapples with shortages of supplies and equipment due to overwhelming demand and lack of alternatives, while the private sector faces the threat of bankruptcy, ultimately contributing to the collapse of the healthcare system in Iran. Because of these conditions, there is a regression in the healthcare system to methods reminiscent of past centuries, leading to an increase in mortality rates.
In these circumstances, the Iranian regime not only neglected to increase the healthcare budget, but also failed to allocate even the minimum necessary funds for the healthcare system. Instead, government-affiliate clerics have resorted to spreading superstitions and advocating praying as a remedy during illness. Even in addressing the COVID-19 pandemic, Khamenei recommended recitation and prayer as a treatment approach. Meanwhile, the regime's leaders themselves benefit from top-tier healthcare facilities and often travel to European countries for their medical treatment. Moreover, the prevalence of the healthcare mafia, corruption, and embezzlement of billions of dollars within the Ministry of Health and Medical Education has created a dire economic and difficult situation for nurses in Iran. This has led to over 1,000 nurses migrating from Iran annually, while others face unemployment. Shahryari, the head of the Health and Medical Commission of the regime's parliament, stated 9 months ago regarding the immigration of specialist physicians. In the past 2 years, nearly 10,000 physicians, the majority of whom specialists and super specialists, have received a good standing certificate, and this could deplete our specialized and super specialized fields of human resources in many areas in the coming years. According to statistics from the World Health Organization, there should be 10 nurses employed per 100,000 people, a ratio commonly observed in the European countries and considered standard globally. Allocating 3 nurses per 1,000 individuals is deemed the minimum nursing workforce requirement worldwide. However, in Iran, only 1.01 nurses are employed per 1,000 individuals, significantly below the minimum standards established by global benchmarks. The ideal nurse-to-patient ratio in general wards is typically considered to be 1 nurse to 4 patients. However, increasing the number of patients to 6 puts approximately 14% of patients at risk of death within 30 days of admission. Moreover, increasing the ratio to 8 patients results in approximately a 31% increase in mortality. Despite the shortage of nurses in hospital departments, nearly 50,000 unemployed nurses stand ready to serve but remain unutilized due to budget constraints. During the COVID-19 pandemic, many nurses worked tirelessly around the clock without proper rest shifts. However, rather than receiving professional and financial support, the Mullah's regime dismissed 5,000 nurses after the pandemic. The situation for physicians is no different. According to global standards, there should be 3.5 physicians per 1,000 individuals. However, in Iran, this figure is at most 1.6. The Iranian Medical Council have underscored the severity of the healthcare system in Iran, warning that if current condition persists, the country will face a shortage of physicians in the coming years. This will force us to send patients abroad for treatment at significantly higher costs or import physicians from countries such as India, Pakistan, the Philippines or others, ultimately resulting in a setback of up to 40 years for the healthcare system. According to the World Health Organization, the average annual income of a physician in Iran in 2019 was approximately $10,000, a stark contrast to the significantly higher average annual incomes of physicians in countries like the United States, approximately $294,000, in the United Kingdom about £136,000, Canada about $258,000, Australia about $207,000 and Germany about $111,000. Former Healthcare Minister Iraj Fazl also referenced countries such as Bangladesh, Syria, Pakistan, India and Iraq, pointing out that an examination of the consultation fees and earnings of general practitioners and specialists in these countries and neighboring nations revealed that the income of physicians in these regions are at least 3 times higher than those of Iranian physicians. For this reason, protests by nurses and doctors concerning their livelihoods and professional situation have been ongoing in Iran for years. Protests by healthcare personnel have frequently been met with suppression and arrests. Additionally, some young doctors such as Dr. Aida Rostami, who had recently obtained her medical license, were abducted by the Revolutionary Guards during the widespread protests in 2022. These doctors were volunteering to treat the injured who had been wounded by the gunfire of the military and security forces. They were subsequently murdered and their family were coerced into claiming that Aida had died in a car accident. As a result, the Mullah's regime have monopolized the production of medicine and treatment, resulting in the exorbitant prices for drugs and medical services. This has created another avenue for exploiting the people and funding its own expenses. Moreover, by undermining the healthcare system, suppressing nurses' protests, and forcing migration, it has depleted human resources in the healthcare sector, pushing Iran towards a catastrophic situation.